Yeah, let me know when you start.
Okay, we're recording.
Okay, good afternoon, everyone. We are here with Shannon. She's a registered dietitian, and we will be sharing her experience and her journey in this episode of The Curious Entrepreneur. So, Shannon, please give us a brief introduction and we can start our episode.
Absolutely. Well, thank you so much for having me. My name is Shannon Parks. I'm a registered dietitian and personal trainer. I have been in the wellness industry and in healthcare for about a decade, and I have a completely virtual private practice that I love.
Okay, wonderful. So, I know since like the virus thing, happened, everybody is converting, their physical practice into virtual thing. So is it you just converted recently, or you have been doing it for long?
I've actually been virtual from day one. I
Uh-huh.
have a little one. I have a little child at home, and it's just a lot easier for me. And beyond that, it's a lot easier for most of my clientele being virtual. I don't have to worry about trying to, oh, I've got to leave work early to go physically meet the dietitian somewhere, or I've got to, make my appointment based around what she has available at her office, so on and so forth. Virtual, it seems to be most convenient for everybody. So I was a little bit ahead of the curve before all of this coronavirus pandemic stuff happened and everybody decided to go virtual.
No, perfect. So let's start with your journey. So walk us through like from the day you graduated and from like the day you are, how's your journey been?
So my journey, I think, is a little bit different than a lot of people, because for dietitians, much like other healthcare fields as well, like physical therapy, an example, we have to do some supervised practice time after completing our degree before we can sit for board certification. And when I was in my supervised practice, I was expecting my son. And so kind of the writing was already there on the wall for me as far as what life was going to look like after supervised practice. I knew I was going to have a little one. I knew that getting into a traditional clinical setting where I was going to be working, 8 to 4:30 Monday through Friday, and then trying to take care of myself and my household and my child was going to be a lot. And so I started kind of exploring other options towards the end of my supervised practice time just to see what was out there. And that's when I came across my current business coach, whose name is Greg Todd, as you know. And he highlighted for me a lot of the opportunity that was out there beyond what I had even thought about as far as having a virtual practice as a dietitian. And so I completed all of my hours and I passed my board certification and I opened up my private practice within 2 months after that. So I never went into a clinical position. I never went into working in a hospital. I never went into working in a long-term care facility. I just opened up my private practice and said, this is what I'm going to do. And so I opened up my private practice in January of 2019.
Okay. So tell us about like some of the struggles you have faced or anything, some difficulties you have faced to, move or start the virtual practice.
So I don't think that for me necessarily starting came with a lot of difficulties. It's um, pretty cut and dry as far as how to start a business. You
Hmm.
get your LLC, you make your website or your podcast or whatever, your blog, make sure all your licensing and insurance is in place, and then you're free to see patients. For me, the difficulty comes now that I've been in it for a little while, maintaining it and continuing to grow it and see through the vision that I have for my practice as it continues to evolve, and honoring that in the way that it functions, not only for me, but for all of my clientele too. So I think that can be a little bit troubling or troublesome for some, because they tend to believe, well, I started out doing X, Y, and Z, so I just need to continue down that path, instead of realizing as business owners, especially those that are in the virtual realm, you can pivot at any point. And so I've been doing a bit of that for myself lately. I've been pivoting a bit, and following what feels right instead of just continuing down a path that I had already established.
Okay. Now, see, diet is, I feel, subjective, because the definition or meaning of diet is different from person to person. So tell us about your, belief or, the way you approach the diet.
Oh gosh, we could be here all day. I am actually an intuitive eating and anti-diet dietitian. So I don't practice or subscribe to or prescribe traditional restrictive diets because they tend to lead to further disordered eating for a lot of people, food obsession, body image dysmorphia, feeling out of control, feeling guilt, feeling shame when it comes to food, and uh, perceived lack of self-control or lack of willpower. So I don't subscribe to any of that. But when I say the word diet, what I'm referring to is what you eat every day, not the set of rules that you're following per se. So for me, and I would think that a lot of dietitians would agree that for us, diet just means what you eat. It doesn't necessarily mean paleo or Atkins or Whole30 or keto or low carb or whatever these fad diets are. It just simply means, how do you nourish your body? What do you eat? And for me, I bring the mental and emotional awareness to how what we eat and how we eat makes us feel, and the thought reflection that comes as a result of that.
Okay. So, have you identified any niche that you try to serve more? Kind of weight loss or athletic nutrition, or something general nutrition, or what is something that you like to do and you would like to continue doing it?
Yeah, so my niche is actually intuitive eating and health at every body size. I specifically work with women in their 30s and 40s. Most of them are moms. Women tend to be hardest on themselves. And I'm a woman who's also a mom in my 30s who went through years of body image dysmorphia, who went through years of trying to diet my way down, who went through years of feeling really uncomfortable in my relationship with food and feeling really uncomfortable in my relationship with my body. And I felt so many breakthroughs when I started practicing intuitive eating and health at every size for myself, that I just felt so compelled to serve other women who feel similarly to how I did for decades.
So when you see a client, like, since I'm a physical therapist, I will try to push myself into, like, do you emphasize on diet and exercise, or you just focus on diet and let other person handle the exercise part, or how do you handle that?
So I'm a little bit unique in that way. I guess my answer is twofold. One, the first part of the answer is that prior to becoming a dietitian, I have a degree in exercise science. So I've
Okay,
been a ACSM accredited personal trainer for over a decade now.
nice.
And so I worked in the fitness industry for a long time before I became a dietitian. So I love the sports science, the exercise science part of exercise. The second part of that answer is I'm by no means a physical therapist. And I tell people straight up, listen, if you develop pain, if something doesn't feel right, I'm going to refer you out. I've got a wonderful network of physical therapists in almost every state in multiple countries. And I would much rather a trained medical professional assess, evaluate, and treat my patient instead of me just saying, oh, well, we just won't do that exercise. We'll just move on. And I think that that is an approach that needs to be taken by more healthcare practitioners, that we have to start realizing the beauty is in having an interdisciplinary team.
Yep.
The beauty is in saying, listen, me fixing your physical ailments, that's not my specialty. That's not my wheelhouse. Let me send you to a physical therapist. Let me send you to a chiropractor. Let me send you to someone that can fix that. And vice versa, I would expect that if a physical therapist saw a patient who had really big struggles with their nutrition, or they were lacking good nutrition, or they felt out of control with food, that they would say, you know what, this isn't my wheelhouse. Let me refer you out to a dietitian. And
Yeah.
in that way, I think that instead of coming across to the potential patient as um, being very money hungry, if you will, it kind of demonstrates that you have a deeper level of care for them. I care enough about you that I'm going to refer you out to someone who can genuinely take care of you. And then
Yeah.
I'm still going to provide you value and service in the areas that I can. And I'm going to work with this other healthcare practitioner to make sure that whatever you're doing with them, I'm on the same page, and vice versa. We're going to work together and we're going to heal you together. And I find that I do that a lot with physical therapy, with chiropractic, with functional medicine, with even general healthcare practitioners, MDs, DOs, so on and so forth. And I think that the people that I work with appreciate that.
Hmm. And I would 100% agree with that. Even I believe the same pathway, like, the holistic approach. As long as you're keeping patient care in mind and utilizing multidisciplinary approach to help the patient, they will see that and they will really appreciate always. Not like, just send you like flipping out referrals. People, even though like, somebody's non-medical, they can see what is happening, right? So when they see that, okay, just because of combined approach, now it's really like, I would share my personal example. I had a patient with knee replacement. The first day I saw her, she was 305 pounds. So I knew from the day first that she needs to be managed for her weight if she's looking for, protecting and maintaining that joint for next 10, 15 years. Because being overweight, that is going to be added burden to that joint, which, will not last for 15 years, which is normally supposed to. But, those risk factors will add up being having a second surgery less than 10 years. So I work with a dietitian. Like that was a 6-month program actually we did, and she came down to 240. So she lost
Wow.
almost 80 pounds in 6 months, and she went through the rehab and stuff. And like she cannot thank me enough for that.
Yeah.
So
It's powerful that what we can do when we work together instead of, just having our own interests in mind and saying, well, this is my patient and I worked hard to get this relationship and I've established this relationship and, so be it. Instead, saying, well, let's work together on this for the best benefit of this patient to make sure that they're going to get the best possible results that they can.
okay, so let's talk about some career. So in this episode, we also talk about like side hustles. So as a physical therapist, they do type of side hustles. So as a RD, do you have any side hustles?
So my side hustle, if you will, is working PRN as needed at a local hospital. I do that because I love being on a clinical interdisciplinary team, and I work on a gastrointestinal floor in the hospital. And so I do that because those are not the type of patients that I'm going to see in my private practice. And I love using that part of my brain. I love being in the nitty gritty with intense, acute, or chronic medical conditions and how are we trying to solve them all working together. I really enjoy that. But I know that a lot of dietitians have side hustles as far as, being a part of an MLM nutrition company or selling supplements or things of that nature. I've never dabbled in that. I don't really feel a need to. I'm more of a holistic, whole food approach, and supplementing with things that you can get at your local stores versus having to pay high dollar for products that are not vetted by anybody. And, that's just my personal opinion. So I think a side hustle as a dietitian can kind of vary, but for me, it's just working at my local hospital.
Got it. So I know you also help, folks from SSPT. So tell us about, more about that. Like, how do you help, and ways you can help or add value to it.
Yeah, absolutely. So I am an ambassador coach for Smart Success Healthcare, which is run by Greg Todd, my business coach. And I coach others through the beginning stages of starting a practice, whether it be virtual, in person, combination, whether it be they want to write a book or publish a course or start a podcast, whatever that may be. I treat those people very much like I treat all of my clients, in meeting them exactly where they are right now and helping them forge the path forward to where they want to be. And I absolutely love it. I didn't realize that I had such a passion for helping others and coaching others towards success, but it's become something that I really, really enjoy, and look forward to continuing to do for many years to come.
Sure, no, definitely, and I know you are a good coach.
Oh, well, thank you.
I have some personal, experience, so I can share that for sure. Okay, so let's talk about, some ideas of like, does, being a RD, like treating a normal person for diet and like somebody who's been involved in sports, how do you handle it, or how does it differ?
So again, I think it goes back to just meeting the client exactly where they are. Because let's say you came to me and you told me what you eat in a day or a week or whatever, and I said, "Oh no, that's not good. None of that is good. We've got to totally revamp the whole thing." Suddenly, you feel shame and you feel guilt, and that's not going to get either one of us anywhere. And so what I do is I work to teach people how to incorporate a concept that I call gentle nutrition. So it's not being so strict on yourself that you can't have the foods that you love as frequently as you love to have them, but more so saying, okay, I really, really want to have pizza tonight. All right, fine. What can we add to that meal to make it more nourishing for your body? Can we add a side salad? Can we get veggie toppings on the pizza? Can you have fruit as a dessert? Can we do a whole grain crust? What can we do to make that a little bit more nourishing? And then from there, we do that with all of their meals, just so that over time they can slowly start incorporating more nourishing components to their meals versus thinking that the way that they're eating is entirely wrong.
Got it. So, like, what will be your advice to the new folks coming out as a RD? Like, uh, share some of your, advice or whatever you want to call it.
Yeah, my advice would be to explore private practice. It is financially lucrative, and it is the best way to get your time back, honestly. In a hospital setting, you're going to work traditional hours, you're going to get a measly salary most of the time. And within 4 months of opening my private practice, I was able to get enough net monthly income to outdo what I would have collected on a full-time hospital salary. And that was
Got
just within 4 months of opening my practice. So I would highly
it.
recommend look into opening your practice. Don't be afraid of having a private practice. Don't be afraid of being completely cash based. I'm completely cash based since day one. I don't take insurance. I want to serve my patients and not insurance companies. So, don't allow the fear of the unknown to get in your way. Instead, find a great business coach that can guide you. Come hang out with me in SSHC if you want. And put yourself out there, because the need is there for your services, and nobody is going to know what you have to offer to the world until you start offering it to the world.
Got it. So let's talk about some common misconception people have about diet.
Okay, where do you want to start? People tend to think that dieting is the solution to the problem that they're having. They tend to think that dieting is that they're the problem, not the diet. And what I mean by that is, when we go on a diet and we go through the restriction part, whether it be restricting calories or food groups or types of foods or times during the day that we can eat, um, whatever it is that we're restricting, that leads to a sense of deprivation, which causes the cravings that we have to soar dramatically. Because what's the first thing that we want when we're told that we can't have something? Exactly what we're told we can't have, right? That's just human nature. And so then eventually we give in and have the thing that we're not supposed to have, and then we beat ourselves up, and we get caught in this mindset that it's our fault, that we're not able to stick to the diet. Oh, it's my willpower, it's my determination, I'm just not strong enough, whatever you want to say. But the reality is, it's the actual diet in and of itself. It's the whole concept of dieting that sets us up from failure from the beginning.
And like, see, one thing I see a lot of like more and more is like eating out. Okay, eating out has contributed a lot to the obesity problem that we are having. Like, of course, there are options like a healthier option, but I would say the ratio is still 80-20. And when you want to eat out, the chances are you will end up eating junk food more than, going to the salad bar and eating like if there is 100 junk food store, there is one salad bar store, kind of thing. So you know how people preference is. And I think that leads to, a lot of problem later on after, 50 plus or 40 plus.
Yes and no. I actually kind of cringe at the word obesity, because the BMI scale that was developed back in the 50s was developed by pharmaceutical companies who were trying to push weight loss drugs, and they needed to create a BMI scale to be able to create medical coding that would have insurance companies approve these weight loss drugs. So it's all a money-making scheme anyway. On top of that, I have seen patients who are obese, okay, by standard, clinically obese, and they have no poor health conditions, beautiful lab values, great blood pressure, they're physically active, they eat well, they're just in a bigger body. And then I've seen people who are normal body size or normal BMI who have got like 10 diseases and 20 medications and blood pressure all over the place, and they don't take care of themselves and they're sedentary. So is it really about body size? I don't think so. And I think the more that we categorize people as you're obese, it tends to lend this thought pattern that fat people are just lazy and they don't take care of themselves. And that's a blatant lie. And it marginalizes people who are just genetically in bigger bodies. Now, does lifestyle and what we eat play a factor? 100% yes, of course. Science stands behind that. But that's not the only reason. If we look at a family, are your family members similar in size to you? If the answer is yes, there's probably a genetic component here. If the rest of your family is very slender and you are heavier, okay, maybe it is lifestyle factor. Maybe it is diet, but me shaming you and calling you obese and telling you that you're too big is not going to help you.
Mm-hmm.
So instead,
Yeah.
I help people get to a place where they can differentiate their self-worth from the size of their body, because we live in a culture that ties the two together inappropriately more often than not.
Like I do not mean about like BMI, but yeah, even my personal, definition of BMI is totally different, because even when I see patients or when I used to see a lot of patients, uh, of course, like when like people ask me about like simple example is healing. Okay, so again, like knee replacement patient, and if they are like, the common question is how long is it's going to take me to heal? Okay, now, my answer is always your body heals, differently from everybody else. The normal window can be definition, okay, that this is the range, but you cannot just put hard line, okay, 35 is the cutoff or 36 is a cutoff. Like there can be a range to define, but there cannot be a cutoff that, okay, if you have 35.1, you obese or you overweight or, stuff like that. As long as you're healthy, you should be fine with that.
Well, and I think that we have to shift our priority here away from just looking at someone's body size and more so looking at how they take care of themselves or don't, what health conditions they have or don't, how they eat, how they move, what their mental health is like, what their sleep is like, what their stress is like. It's about looking at the entire person instead of just judging them based on their physical appearance of how big or small that they are.
Okay. So I think we'll do a lot of like live videos too, Facebook Live and stuff. But for this episode, I think we cover our topics. So give us the final words for RDs that are out there in the field, or trying to become an RD. Like your
Yes. So RDs who are out there in the field, I would say that there are more options than what you're presented with in school. Explore those. There's more to learn than what you learn in school. Explore that and give yourself a chance. Put a little faith in yourself that you can go out there and you can create a flourishing private practice, or that you can go out there and you can work in a clinical setting and be great at that too, or both. Really, with dietetics, you can do so many different things. I just find for myself, happiness lies in a combination of having a flourishing private practice that's completely virtual, that allows me to spend time doing the things that I love outside of work, spend time with my family and traveling and doing all sorts of fun activities instead of being chained to a desk 40, 50 hours a week, in combination with picking up shifts at the hospital when I want to be a part of that environment too. So realize you can have life by design if you want it.
Yeah,
That's up
and
to you.
I think that itself motivated me to start doing all these, because more and more I see is people completing 5, 6 years of college, coming out of all the college skills, but they don't have a street skills, and that's what I'm trying to pass it on to by doing all these videos and sharing information that the moment you pass out, you need a lot of skills that is required for you to go up in the ladder, or be from employee to becoming an employer. And you know by sharing all these experience and journey, like, this is what I wanted to pass it on to the people who are like starting out, or like they are still stuck in the 9 to 5 phase, where they are looking for an out but they don't see a light somewhere. So I think like even later on we will be grouping out with you and some other expert on Facebook, and making some more videos about how other skills are important, or sharing out the skills that you have developed apart from being an RD. What are other skills that is coming handy, like just managing online stuff, right? How to manage technical part of it. It does, like, nobody teaches you in college how to handle Zoom videos, or how to
True.
do live, right? Or share, or how to use the virtual practice in a way that is more friendlier to your patient. How to how you can use the technology, and other means of ways that you can leverage to expand your practice, right? So I think we will do like some videos later on about these things, and we can have you again for
I
that.
would love that.
Uh, uh, okay, I think we are done for today. But thank you, Shannon, for your great interview. We will be looking forward for some Facebook Lives and some more videos from you for sure.
Wonderful. Well, thank you so much for having me. This was so much fun.
All right, thank you, Shannon.